This is a short session on the clinical anatomy of the palatine tonsils and the nasopharyngeal tonsils. What we'll try to do is, we'll try to discuss about three important subtopics like tonsillectomy, the peritonsillar abscess or quinsy, and adenoidectomy. First, let's talk about what is tonsillectomy. Whenever there is acute inflammation of the tonsil, we call it as acute tonsillitis, and surgical removal of tonsils is called as tonsillectomy. One of the important complication that can occur during acute tonsillectomy or following acute tonsillectomy is torrential bleeding, which occurs from the peritonsillar space. Within the peritonsillar space, we have the paratonsillar vein, right? Now, the ligation of these blood vessels can get loosened post surgery, resulting in severe bleeding. So, injury to paratonsillar vein should be kept in mind when tonsillectomy is attempted. Two important indications for tonsillectomy are acute tonsillitis and peritonsillar abscess. Now, what do we mean by peritonsillar abscess? Peritonsillar abscess refers to accumulation of pus within the peritonsillar space. What is peritonsillar space? As we know, the lateral surface of the palatine tonsil is separated from the tonsillar bed, which is initially covered by the pharyngobasilar fascia. There is loose connective tissue. So, this space with loose connective tissue is what we call as peritonsillar space, and paratonsillar veins are one of the most important content which is present in this area. So, any infection of the tonsils, if untreated, can result in accumulation of pus in this peritonsillar area, which can present as a huge swelling from the roof of the oral cavity or the soft palate. The only way of treating this is either by medical management, and if medical management fails, surgical drainage. Peritonsillar abscess is a very painful condition characterized by foul smelling breath or bad breath or halitosis and severe odynophagia or pain in the oral cavity. This is regarding peritonsillar abscess. The third important subtopic is regarding adenoids. What are adenoids? Nasopharyngeal tonsils, which are located within the roof and the posterior wall of the nasopharynx, when they get enlarged, is called as adenoids. Adenoids, if occur chronically in children especially, it can lead to a characteristic clinical feature called as adenoid face. Now, children with chronic adenoid problem can present with an open mouth, a high arched palate, and an elongated face. All these features are suggestive of adaptation to oral breathing. The adenoids, when they are removed surgically, is what we refer to as adenoidectomy, and adenoidectomy is essential to prevent the development of adenoid face. So, tonsillectomy, peritonsillar abscess, and adenoidectomy could be three markers for your university exams, and if asked, this is how you must describe the anatomy or the clinical importance associated with these three structures. That's it for this short session.